Oh dear.
What language is that?
Yeah. You're cutting out a whole bunch.
Everyone's talking. Okay. Is it better?
Yeah, it's better. I muted the headquarters so you can talk. I'll unmute them when they get started.
Our first speaker, she is an adult advanced practice RN, a psychiatric mental health nurse practitioner, a chronic alcohol and drug addiction counselor, and a certified clinical professional. Susan will explain the advanced practice registered nurses gaining full practice authority initiative petition. Welcome, Susan.
My first question is how many of you actually see a nurse practitioner when you go to get health? Yeah, that's exactly right. And most people prefer because we take time to talk to people. We take time to learn what they're about, what they've got going on, how to live with whatever, diagnosis or, things that they're having to deal with. How to take your medications. That doesn't get discussed. I can't tell you how many people I have cured of upper indigestion because they were taking their med with all their other meds in the morning instead of by itself. They think I'm a miracle worker. So it's stuff like that. So I go a long ways from adult health. I worked at the VA for 30 years. I started the liver clinic there, and I was independent, and I just loved it. It evolved from hepatitis to liver diseases to transplant to, it just grew and grew and grew. The day they came to me and said, you have to see more patients and take less time. I'm like, I'm retiring in 4 months. Right. No. So I've done a lot of things. After I retired, okay, my addiction is learning. I always have to be getting a course or something or other. So I went back to school and got my psychiatric nurse practitioner certification out of UMKC.
Wow.
And I thought that all this would be over by the time I got done school, but they've been battling this for 25 years. Back in the late and early 90s, they made nurse practitioners have to be in a contract with a physician. And at that time, it was not uncommon across the country. Now we are one of 5 states that still has it.
Has what?
Has not.
Have to be under supervision of a physician.
Right.
And here's the kicker, pay them for it.
Yeah.
I just finished a survey of nurses across the state, and they're having to pay anywhere from $6,000 to $52,000 a year. And the median is $12,000 a year to the physician. No. Now, a lot of organizations pay the physician for, taking on the nurse practitioner, but the Board of Healing Arts chair has 6. He doesn't work anymore. That's where his income comes from.
Oh.
Wow.
Yeah. And the sad part is Missouri is a healthcare desert. We have so little healthcare. The only county that has actually enough is in Kansas City. Yeah. Because outlying, areas of the counties get less and less and less. I mean, how many hospitals have they closed in the past couple of years? Yeah. People are having to drive much further to get health care. And that's our whole point with us being independent. We tend to go to places where people are, where we grew up, where your family is, that kind of thing, and do practices. Whereas only 34% of med school graduates stay in Missouri. We're educating for the rest of the country. Yeah. Now, Missouri is number 47 out of 50 states in healthcare outcomes. So for morbidity and mortality, we are at the bottom of the barrel. And as we all are getting older, physicians are retiring, they're dying, there's less and less healthcare available. And they feel that my 10 years of education isn't sufficient that I would be able to manage a patient load. Well, that's what they say. Oh, well, we want our patients to be cared for. Oh, really? So what about the 47 out of 50 thing here? You know, are your patients getting cared for? Well, you're in Springfield, you don't care. Yeah. So what we've done is we put together a petition that we are asking for independent practice. And actually it's House bill by Perkins, 1773 is the one that's going the furthest so far. We're asking for independent practice. We're adding, because a lot of the states do this, adding kind of a mentorship for the first year, 2 years, 3 years, however it comes out to be. Truthfully, the new grads coming out are not as well educated or energized to reach and read and research and do those kinds of things. We were talking about this generation this morning. It's like they don't want to work. Glad it's not my kids. So anyway, yeah. So the petition states that we can be independent, and it used to be we had to be within, at first it was 35 miles of the physician, and then it was 50 miles of the physician, and then 75 miles of a physician. And they actually took somebody to task for being 1 mile over the limit. No kidding. Yeah, ridiculous. So for this contract, the physician is supposed to review 10% of the nurse practitioner's charts for the week, 2 weeks. So 2 weeks of charts, 10% of those charts, review them and co-sign. It's our responsibility to get those notes to them. Then every 2 weeks, they're also supposed to appear in person in the clinic. I had one person that did this with the salary survey also. She'd seen her physician maybe once in 2.5 years. It's not happening, but no one holds them accountable for that. And it was Kathy Steinhoff who suggested that I get that data as well, so that that it kind of has more power to the punch. Yeah, yeah. So we have divided the state up by nurse practitioners for the U.S. congressional districts, like they do for all the petitions. So I'm the coordinator for District 3, and so we each have a coordinator for each district. And so what we'll be doing around April 28th or so is collecting all the signature things and going over them, making sure they're okay, and that kind of stuff. We do not have money to pay people to do this. Mm-hmm. So I'm kind of the ringleader for our district. It was when I found out that Broadway was the cutoff between 3 and 4, I was like, no, isn't that ridiculous?
Yeah, we think so.
Yeah. Mm-hmm. So I brought a handout that I'd like to give each of you, and I can get it to you to get posted. Yeah, absolutely. Here. Not all of them are pretty color copies.
I'll take the color and scan for everybody. Are they all the same?
Yes. Oh, wait a minute.
We need that.
I got in there. That was instructions for filling out the petition.
Here you go.
So I've been to many events, and these are all the counties that I've had to account for.
Oh, wow.
Yeah, because I went to St. Charles to the St. Patrick's Day Parade. I've been in Jeff City a lot, St. Louis a lot, all over the place going to, and mostly I've been going to a lot of the political meetings, that the fundraisers and those kind of things to get people. Our biggest thing is that at least we are educating people, even if we don't get enough signatures.
Right.
I was just saying to somebody a little bit ago,
First time you're gonna do it, maybe again.
they're going to change the number of signatures required. They're going to pass that this year. I bet you.
Actually, we need to all be writing about that.
Yes. And our biggest stumbling block is John Patterson's going to be the next Speaker of the House. Surgeon.
Yeah.
Was belligerent even to his own people when we went to visit his office. He has 5 nurse practitioners working for him, and
5 times 12 is 60.
Yeah. So, what was I gonna say?
Sorry. He has 5 working for him.
It's okay. Yeah. What was I gonna say?
He's going to be
I'll come
the
back
Speaker of the House.
Oh yeah, I got that. Yeah. All right, it'll come back to me.
It's going to be bad.
Okay, everybody, don't get older. It's very
No, you're
stressful.
good.
Yeah, yeah. So I've got petitions if people are willing to sign. And you can't e-signature, sorry, out there. So I'll just pass them down.
I think I signed it at the library.
Can we
I don't
sign
I'm
for
not
some of them
sure.
if they say yes?
We have to swear at the bottom of this thing and have it notarized that the people who are signing this is who they say they are. And if that should happen to get out through the grapevine, we'd be screwed.
I've already signed this.
Well,
Had I better not sign
You can
it?
You can
If
only
I-
sign it
technically,
yourself.
if Herb authorized me to sign his name, that's the power of attorney. It isn't written, but it's a legal power of
I
attorney.
understand
Okay,
that.
who wants to fight that fight in court while
I
they?
don't think it's a
While
good
they
idea.
disrupt-
Let's
The
not go down this
Secretary
road.
of State's office are horrible.
Yeah.
If you read this petition as it's written, we had to go 3 times to get them to change the wordings. And this last time we had to threaten to sue with an attorney. They had put in this one that we would be allowed to prescribe narcotics scheduled 2 through 4, like hydrocodone and fentanyl. That would be on the ballot. I mean, people are gonna see
That's
fentanyl.
good. That's
Right.
terrible.
Yeah.
It's terrible balance.
So, I met you at the chili supper, and
Yeah,
that's how
yeah.
I got you
Yes,
together with,
thank you.
so it sounds like you'll try again, you just started around then,
Or you
and,
just keep going.
grow the movement. My question was, would you be able to do telehealth under something like this?
Oh, yeah, we already can.
Oh, you already can, as long as the physician.
Yeah, but here was my point. My representative was like, oh, great, there's gonna be all this telehealth. I'm like, excuse me. We're in the boonies. People in rural Missouri can't afford to get internet. There is no big way of, no cables, and they'd have to afford satellite. No, that is not the be all and end all. People are having to drive an hour and a half to get healthcare.
It's just in inclement weather and things like that, and also it's helpful for some. And hopefully we'll change that internet thing.
But it's not going to be the answer.
Anyway, I think I signed it at the library, so I better not sign
Okay.
it again.
Yeah, me too.
Yeah, I've signed it. Should I sign it again?
No.
Just in case?
No. No, it's just the opposite.
Now,
Yeah.
now,
Okay.
I am.
Can I
proud
ask a
of
question?
my wife. She's for me, and I signed
Please
her
don't
name
make this,
every
please
day.
don't make this complicated.
No, Scott.
Sorry.
Can I make
happy-
another comment? I want to ask you about physician assistants. In the
Okay.
past, I wrote, this is Sue Tillema. I wrote the job description for mental health when they put in nurse practitioners. I later wrote it for physician assistants. What I found, what the physician assistants got paid more and they had less education. Are they required to be under a physician?
Yes, they have to be in the same building as the physician.
Okay, interesting.
Yes. And they can have a bachelor's degree in just about anything and then go to 2-year PA school.
Right.
And then they're with the supervision of the physician. Now, given time, I've worked with some great PAs, but I had a client that went to a local facility because I make sure, this is something that I said to my group when we were all together. Okay, I went back and got my 2nd degree in psych, and it was one of those things where be damned if I'm going to pay a physician to be my supervisor. No way, I am not doing it. I've already been independent. No. So I do telehealth. I took all my education and I make sure that my clients have a connection with a primary care provider. And then I send the primary care provider a summary of what's going on and recommendations as to what I think they would be helpful for them. So that's how I get around it. And I do like pro bono and cheap, and I'm after the people that can't afford it.
Suzanne, are there guidelines as to when you have to refer to a physician? In terms of,
In which-
cases that require an MD or?
Let me answer that question with, nurses are the most trusted profession in the country for 23 years in a row. And what we were being accused of is that we would not do that. We would not refer people we know what we don't know. We know when somebody's complex, and the patient is our first priority. And for them to say that, we wouldn't refer appropriately was really a slap in the face. And no, there are not written guidelines for that. we are educated enough that we would know when we need to refer somebody, just like any other healthcare person. When you know that they're complicated and need stuff. I've referred clients to psychiatrists because they were just so batshit crazy. There was nothing I was going to be able to do for them. So yeah, it takes 6 months to a year to get in to see a psychiatrist. Yeah. More questions?
I have a comment more than pass it on to you and to the other speakers, but here at the office on Saturday mornings, for the next 3 weeks, we're publicizing, we're gonna be doing drive-through petition signing for the reproductive rights petition. We're just gonna be sitting, we'll have somebody sitting out here in the parking lot. So if you want to, we're not promoting anything else, but if y'all want to be in here with us.
Awesome, because I sent Scott a question that if we could come and do that. So
And just give me your petition for tomorrow and I'll carry it to you, because I'm the one here tomorrow.
You're over
If you
one.
came to me before, but I haven't been active on this.
that's fine. That's fine.
She's asked for questions. Go ahead, Nancy.
In here.
Oh, but I can go petition or if we could.
All those lawyers in here.
Right,
Yeah.
Tillemans, did you have another question?
I have one. I'm confused on an important matter. I know a number of nurse practitioners or nurse clinicians here elsewhere and also here, and have a lot of respect for them, but I am unclear. What one can say in summary about the difference between nurse practitioner certification, expectations, and expectations for MD and DO. Can you tell me what the practical difference is between these categories?
Sure. DOs and MDs are trained to diagnose. That is their focus. You get a 15-minute office visit with a physician, and they may or may not catch everything that you have going on. And I have clients that this is happening to. So our appointments are longer, and our focus is that person and what it is that they've got going on in their life that's going to make their diagnosis doable. And so we help people learn how to live with what they have going on. DOs actually get some psychology in their program. Physicians do not. It's very difficult for them unless some of the family practice guys are much better at this than others, but specialists, it's hard for them to even get us to talk to them. I mean, their nose is so high in the air. It's like,
Well,
yeah.
I will add to that. I was needing some help during my pregnancy, and I tried to go to the medical library at the university and look things up, and I found that the the nurse practitioner or the nurses training was such that it helps, as you said, the physician is more on diagnosis and treating the immediate problem. The nurses are more likely to be involved in trying to help you live with the problems you have across the board. And that was my understanding. And I've also heard, happened to hear my sister-in-law, who wasn't a nurse practitioner, but giving instructions when somebody was going home after being in the hospital. It was actually a family member giving instructions too. And that again reiterated that, a doctor will come in and say, okay, you need to do this and this. But she went at some length building up the courage of the person and trying to really explain what they needed to do.
I didn't get it. I think my question might have been misstated. I really was asking, is there a difference in the knowledge or the skill base, not the value orientation?
I understand. Physicians have, and I did research on this, on average 19,000 hours of education time. We have 10,000. Ours is basic, everyday type, talking to people, doing things. And when it gets complicated, which most people are not, then that deserves, physicians look at that, whether it's cardiology, neurology, renal, and all these different specialties. And so yes, there is a difference in our education level. And it's one of the reasons that we've added what's called transition to practice, or TTP, which is in the bill that Rep. Perkins is doing. And that's to get people kind of like a residency. And then in different states, some states have a month, some states have 3 years, one state has 8 years. I'm just like, oh my God. Yeah. So, but all the other states, as I said, there's 45 states where it's either already full practice authority or they also have transition to practice. We're one of 5 that do not.
You know, thank you, Suzanne. We do have 2 other speakers this afternoon. So Kathy, would you like to introduce the next speaker?
Yes, Alex Cook is the Director of Organizing and Campaigns for Abortion Action Missouri, which was formerly NARAL Pro-Choice Missouri. He will present Missourians for Constitutional Freedom's Abortion Rights Campaign Initiative petition. Thank you for zooming in with us, Alex.
Thank you all so much. I am so grateful to be with all of you today, to have both what appears to be a full room of people and a full Zoom room as well. My apologies for not being in Columbia. I have been going to Columbia about once a week recently, but I'm in St. Louis today, where I hail from. So I appreciate that warm introduction. Like it was mentioned, my name is Alex Cook. I use he, him pronouns. That's great. And I'm the Director of Organizing and Campaigns at Abortion Action Missouri, formerly NARAL Pro-Choice Missouri. First, I just want to say thank you to Suzanne for sharing about your initiative. I am very clear on how critical nurses are for healthcare. And whenever I'm in the doctor's office, the nurse is the person I spend the most time with and usually enjoy spending the most time with. So thank you, Suzanne, for doing that work. Also, shout out to our friends at Jobs with Justice and the Healthy Families Initiative. We at Abortion Action Missouri are proud to also be a part of that coalition. Where we gathered, I believe, close to 15,000 signatures to help get that on the ballot. And we're grateful to be a part of that tremendous effort because we are clear on the intersection between abortion access and the right to take time off and also pay for the family, take care of your family members with living wages. But with all of that, I'm not here to talk about that today. I'm here to talk about the campaign Missourians for Constitutional Freedom, which is the campaign to end the cruel and dangerous abortion ban that is currently in place in Missouri. So I believe that this is a room that is pretty well informed around what is happening in Missouri. But first, I just want to talk a little bit. So I will talk to you about our state's abortion ban, the impact it's having, and also about how we're going to overcome it. Before that, though, I'll tell you a little bit about myself. I live in St. Louis. I've been the Director of Organizing Campaigns at Abortion Action Missouri for about 4 years. Prior to that, I was a labor organizer, organizing in higher education, as well as property service workers. So this is coming on my 9th year of organizing in Missouri. And this campaign is unlike anything I've ever seen. Now, I'm really clear on why this campaign is important to me. You might be looking at me be like, who is this white man working on abortion? And that's a fair question. But, you know, for me, when I think about what this campaign means for me, like Missouri is my home. I moved here in 2016 from Massachusetts, and I did not know how long I'd be here. But over the last 8 years, I've decided like this is the place where I want to be. It is the place where I want to have a family. It is the place where I want to have a future. And, you know, when I was a kid, like I was bullied, and I spent a lot of my young adult life and childhood like feeling like I couldn't be myself. And I felt a lot of pain because of that. And something I'm really clear about is like right now we have a state that is run by bullies. We have politicians who revel in the pain of others, who pass laws with contempt, and frankly, like find pleasure in making people feel small. And for me, bans on abortion are one of the most stark manifestations of that really, really disturbing instinct that we see in politics today. And I refuse to accept that the state where I want to have a future, where I want to raise children, that the people I love, my partner, my kids someday will be subject to that kind of cruelty. And so I am very clear that this campaign is our one shot to demand and achieve that future that I want for myself, and I believe the people in this room want as well. So I want to talk a little bit about like what this means, right? Like what it means to live under a near total ban on abortion in Missouri. In 2019, our state legislature passed a law called HB 126. I'm sure many of you all have heard of this. This law, it was a trigger law. And what that meant is, despite the fact that Roe was still intact at that time, the law was written such that if the constitutional right to abortion was overturned, politicians in Missouri would be able to immediately enact a near total ban on abortion. And in June 2022, when the Supreme Court overrode the constitutional right to abortion, our now Senator Eric Schmidt and then Attorney General, within 45 minutes, signed the provision in that law and enacted a total ban on abortion. Missouri was the first state in the entire country to do this. The impact of that ban, it's not pretty. Right now, no matter what you've gone through, no matter what you've experienced, no matter what your situation, people are having to flee the state to go to Illinois, Kansas, sometimes as far as Colorado and Washington, D.C., to get healthcare, even if it means their health is at risk. We have seen stories of people who have been in Southwest Missouri who've gone to multiple doctors, miscarrying, and they have had to go to other states to get the care they need, right? And so like this is the impact of this ban in Missouri right now. And I want to be really clear, like this is not something that Missourians want. Something that I've been able to do and our organization has been able to do for years has go and have like open-ended conversations on the doors with Missourians about how they feel about abortion and how they feel about this ban. Last spring, we talked to thousands of people over months, having open-ended conversations where we started asking them, hey, there's a total ban on abortion in Missouri. How do you feel about that? And overwhelmingly, what we heard is that Missourians do not want that. People may have their own personal feelings about whether or not they would have an abortion, but when it comes down to it, people in our state believe that that decision, that layered, personal, and complicated decision for a lot of people is something that is best between a patient, the people they love and trust, and a doctor, not politicians who are trying to get a good score so that they can get reelected, right? And like that's what's at stake here. We have a small group of power-hungry politicians in our state who are making decisions that contradict the vast majority of people who live here. And so what this constitutional amendment is it is our one shot. It is our one shot to ensure that the true voice of people in Missouri is heard and that we are able to create a basic right in our state constitution for bodily autonomy or reproductive rights, which includes the right to access abortion. It also includes the right to have the birth control of your choosing, in vitro fertilization, respectful birthing conditions, right? Because at the end of the day, we knew when when the Supreme Court overturned the constitutional right to abortion, that they weren't just going to stop there. And so what this initiative will do is ensure that these basic rights, that people can make a decision for themselves and their doctor. And I want to be clear, I have been, this is now my 5th initiative petition campaign that I've been a part of. I have never seen anything like this in my entire life. And the story of this campaign is something that is like rewriting the story of Missouri. The people who wanted to, the people who are in power right now were afraid of the power that this campaign had. When this campaign initially filed efforts back in March, or petition language back in March of 2023, our Attorney General and our Secretary of State colluded to try to keep the people like us, like the people in this room right now, from physically having petition pages in your hands. They made us wait 8 months. They made us wait through the court system and made us wait until the middle of January. I'm not kidding you. People start collecting petitions, right? I'm not going to lie to you all. When I got the news that we were moving forward with this campaign, I was nervous because we did not have a lot of time. Missourians have given me hope, though. At the beginning of February, when we officially launched our campaign, we had 2,000 people come across the state in one night to sign the petition. Since then, we have trained over 1,000 volunteers across the state. And one thing I'm really proud of is last Tuesday, we were able to get 20,000 signatures in just one day on election day. That is, I don't want to brag, but per what I know, that is the highest day of petition gathering that has ever happened in the state, okay? And people like you made that happen. And you are making history and you are proving them wrong. And at the end of the day, they should have been scared because we're going to win this and we're going to get it on the ballot. So the work that lies ahead of us is important, right? There are about 21 days left. It's May 5th. So, you know, that is the turn-in date, but we need to get them in beforehand. We've got about a month left, right? To get the petitions we need. And one thing that you all may know is in Missouri, we don't only have to get a gross number of signatures, they have to be in specific congressional districts, right? One thing I love about Columbia is that you all are situated between the 3rd and the 4th. So I am so excited to hear that you all are holding drive-throughs because we're going to keep doing those. And on top of that, we are putting every single resource we have into every corner of the state. I am spending every weekend for the next month on the road, knocking doors, gathering petitions, and we need you to join us. So I love where you all are starting. And I am absolutely positive that with the momentum that is in this room and across the state right now, the over 1,000 people who are ready to go, we're going to get this across the finish line. So thank you all so much for being here. I'm so inspired by the energy that's in this room and across our state. And I'm grateful to be able to tell you the story of what we're doing. One last thing I'll add, just to kind of just talk to you about what this campaign means for people. Like, this is more than just, like, for me, like, this campaign is about people like feeling a sense of power that they have been denied in our state for decades. We have seen death by 1,000 cuts in Missouri when it comes to abortion access over 40 years. And people have suffered under that. I want to tell you the story of one person on our campaign who's been leading this campaign. Her name is Erica. Erica, and this also tells you like what's at stake. Erica was someone who had a very wanted pregnancy. And about 21 weeks into her pregnancy, or 20 weeks into her pregnancy, she realized that there are such severe fetal anomalies that for the well-being of her current children and her family and her own health, that she would have to move forward and end this much wanted pregnancy. Erica had to fly to Washington, D.C. and frankly, as she described it, she felt like she was like navigating the black market to get the care that she needed for this very wanted pregnancy. And so, you know, Erica was able to get the care that she needed, but she had to travel hundreds of miles and spend thousands of dollars to make that happen. And what Erica has told me is that when she works on this campaign now, she was actually going to take the year off from school. She's a teacher. And so she still had this year off. And so instead of taking care of her child, she's now working part of this campaign. And that is mothering for her right now. That is how she is caring for her family and her child. And like, that is what we get to do right now. So I'm so grateful again to be able to tell you these stories. There are thousands of stories like this across our state. I really appreciate the time. So thank you all. And I'm happy to take questions. I see some hands are raised.
Alex, thanks for being here. Louder. Alex, thanks for being here. It's good to see you on the screen. We've talked some. So I petitioned this past week in the cold at a sort of upper income church. And it was the first time that I really faced opposition, knowing what we're up against.
Yeah.
When we go out and campaign. Now, I think one state, is it Arkansas, that hasn't passed this? Almost every state has passed it when it's been on the ballot, right?
Correct. Yep.
But Arkansas didn't, or they all have?
I don't know of one failing. I believe Arkansas, if I'm correct, is still trying to qualify it to get it on the ballot, but I'm not sure the exact status of it. I don't know any that have come to a vote that have failed.
I think 11 states right now. That's what I hear on the news. But so I just really saw what we're going to be up against, though. And when I talk to people, I tried to say, talk about saving a woman's life when she's hemorrhaging and is having a miscarriage. And, you know, they said, well, maybe the law needs to be tweaked. But it was really eye-opening what we'll need to do. This is Missouri to get those votes. I think we can do it, but it will be challenging. And we'll have to keep our cool. You know, what particularly hurt was when young women wouldn't sign, because this is them. You know, I found that out.
Alice, the example I was going to give was exactly that. I had trouble getting pregnant. My first pregnancy, I miscarried. But to be honest, it was hopeful that I could get pregnant. But I was bleeding so badly, Columbia, Missouri, I don't think I would have lived to get out of the state in 2 hours. I could not get from the bathroom to the wall phone in a small apartment without leaving a trail of blood. That's how fast I was bleeding. And so until I realized that that also was included, and I think many of us are there are a lot of older folks here of an age when we remember that it was only it was illegal to get an abortion and what you had to go through for folks that did do that.
Just the last thing I want to say, Alex, is that can we put out some kind of email to our supporters to be right now writing the legislature? Because right now is when they're considering to make it much harder. We've never gotten 60% on an initiative petition. Right to work was the closest at 57. That would be very hard to get that in Missouri. To write to our supporters around the state to also be writing to their legislators right now. So that was just the last thing I want to say. Thank you.
That's great. And I just want to jump in really quick and say, Sue, thank you so much for sharing that story. And one thing that is so important right now is to uplift those stories. So many people have experienced what you experienced, Sue, and right now, and so often you can feel alone when you experience that. And oftentimes these politicians, they find their power because people feel alone and isolated. So I'm just so grateful you shared that. And that is what's on the line right now. And one last thing I'll say is, like, something that's been so moving to me is it is folks who know what the reality was like before Roe. Like, that is the basis of this campaign. I've actually been kind of blown away. I've been a little disappointed in my generation. They haven't been the ones leading the fight. It's been people who knew what it was like before a time when abortion was legal. And that is such a powerful testament to what this campaign means and what it means to live under an abortion ban. So I just want to say thank you, and also thank you to all of those who have that memory and are honoring that memory by being part of this campaign right now. So yeah, thank you.
I will say another quick thing.
Their last question.
I already
Susan has one too. Sue in the chat.
Can I just do, okay.
Sorry.
I was just going to say,
I just wanted
I've
to
known a
maybe-
young person who was 35 who wasn't sure she wanted to stay in her state with an abortion ban because of the fact she didn't even feel safe to have a pregnancy.
Right. Yep. And a lot of people are in that situation. Thank you, Sue.
I have a question. Knowing that the word abortion is so controversial, why was it chosen as the title for all of this? And is it the same as the women's rights bill?
And can I tag on the question from the chat that asks, do you know yet how this will be boarded on the ballot? I think that's a related question. We could do two birds, one stone. Thanks, Alex.
Yeah, thank you. I appreciate that. So a couple things. I don't have the ballot language in front of me right now, but there is a ballot summary available on the petition itself. However, when it comes to, and so I encourage you all to read that. When it comes to the word abortion, for Abortion Action Missouri, we've actually been very intentional in using the word abortion, our individual organizational messaging, which is different than the campaign messaging. But for our individual organization, The reason we try to use the word abortion is that we actually find that our opposition uses the word abortion 4 times more than people who support abortion rights. So in part, we find that by using the word abortion, it destigmatizes it, it demystifies it, and it makes it so that we can claim this word and not let our opponents do that. Now, I'll be clear too, different messages work for different people. And we have different audiences. And so for our organization, that is the tack that we're taking. For the campaign, there's another set of considerations as well. So I think the best thing here, and this goes both for me, like I when I'm talking to a group of people, I assess like what are the words that are going to resonate with them. But when it comes to the specific instances where I do use the word abortion, for me, it is concrete. And by using it, we are reclaiming that word in a way where we're not just ceding it all to the opposition who try to create fear, stigma, and paranoia around it.
Thank you.
Thank
The
you.
ballot language is on our Wednesday email from Scott.
Okay. For those of you who get the Wednesday email, the ballot language is on it. Scott Crystal has included it. So if you're on our email list, you can check there. Maybe this is a great last question from the chat, Alex, because it's what we all really want to know. Like, are we going to win? Somebody asked how many more signatures still needed. Like, we want to win this thing.
That's right. Yes. So what it's going to come down to, like any of these initiatives, is being very targeted. I don't have any concerns about getting like the total number. It's about making sure that we get them in the right areas. Mid-Missouri, I will just name right now, is a very important area, and we're going to be spending a lot of time and energy there in the next couple of weeks. I encourage all of you to go to MissouriansForConstitutionalFreedom.org, where we are planning on having dozens of events across Missouri, across mid-Missouri. I encourage you all to attend those, and also encourage you all engage your networks, have your drive-throughs. If you have anyone else that you need to talk to, we got a month left to do that. So like make your plan right now. Every Thursday from 4 to 7 p.m., you can turn your signatures in at 404 Tiger Lane. I'll send that in the chat. That is where to turn those in. And if we all put our best foot forward with it, we've got the plan. We just need to do it. So that is what I'll leave you on, but we're going to win this. And I am so grateful to have your support in it.
Dave Razel, did you want to say something real quick while are you Truman? We can come have you sit in Suzanne's seat. So while you switch.
I would like to remind everybody that the next stage of the struggle, supposing this does win, is going to be repealing all the trap laws that are still on the books. That's why we have to have a democratic, that's why people like me have to get to Jefferson City. Otherwise, even with this, the ballot being, it'll be in court for years. You just watch. And so everyone's got to be steeled for it. That's all I'm saying.
Trap laws.
Could you explain trap laws real quick, Dave Razel?
Those are all the specific all the specific rules that were written to hinder the provision of abortion services. Extra rules about how doors are, they're targeted reproductive AP something. Alex probably knows the exact name for me.
Targeted restrictions against abortion providers. It's like what I was referring to before. It's death by 1,000 cuts, right? Making all these tiny little regulations on abortion clinics to make it all but impossible to provide the care, even if there's a legal right.
They've got to all be repealed.
That's right.
Thanks for being here, Alex. So now we're going to transition to this. It says Sarah Catlin, she, her, but it's actually Truman Oaks, I believe. Do you want to just introduce yourself? Are you okay with that?
Okay.
Yeah.
I'm Truman Oaks, he, him pronouns. I'm a student at the University of Missouri. And for the past few months, ever since I moved to Columbia, I've been working on the petition, Missourians for Healthy Families and Fair Wages, which is primarily going to help increase minimum wage to $15 and guaranteed paid sick leave for every worker in the state. I've been working primarily with Missouri Jobs with Justice, which is a nonpartisan coalition of various progressive organizations and labor unions all around the state. I'm personally part of the Democratic Socialists of America, EPSU, and also the Mid-Missouri chapter. I've been gathering primarily on campus, just standing in the speaker's circle, asking people if they want to sign. As like in my specific chapter organization, we gathered about 4,000. Statewide, though, I'm happy to say I don't have any signatures today because we have gathered enough to get it on the ballot.
Right. Whoa, good to hear.
Yeah, still, it is important that we get it to actually pass once it's brought up. It'll be on the ballot in November. But we have had a much easier time working with the state than the abortion petition for sure, because we've been able to gather pretty much on the normal timeline ever since this summer. They were like, here's your petitions, go ahead. Which
They
is
screwed us over too.
yeah.
Secretary of State's office, yeah.
It's very interesting to me too, because I think like obviously raising minimum wage and guaranteeing workers' rights in general is not something that the Republican politicians in Missouri want. But I think that opposing that, they know, is like a much less popular position, you know, so they have to be a little bit quieter about it. And I do have more faith that this one will pass once it gets on the ballot. As for like specific considerations, when we were gathering signatures, it was a little bit more difficult because the campaign wanted to focus on the 6th district in Missouri and not the one that includes northern Boone County, the 4th district. Luckily, all of Mizzou is in the 3rd district, but that means that, you know, we did drive up to Moberly a couple times in Mexico. Very hard to gather there, but, you know, everything counts.
Yep.
I don't think I have to like justify to you all the importance of this campaign. I mean, I know I'm in good company, but it's very important. It's sad that the minimum wage in Missouri is so low. It's even sadder that it would still be $7 an hour if it weren't for this petition happening a few years ago, I think 2018. But, you know, times are still tough. $15 is a great step in the right direction, and especially guaranteeing paid sick leave. In Missouri, there's no standard for paid sick leave for all workers. You know, specific employers offer it, and I'm not sure, but maybe public workers get it. But statewide, there's no guarantee. Having worked a minimum wage job myself for years as a younger person, unprofessional labor.
Yeah.
But I definitely see that importance for me and my coworkers. Any questions that you have about the campaign, I'd be happy to answer.
Does the minimum wage raise with the cost of living or something?
Yes, the minimum wage right now is $12.30 an hour, right? Even though the last petition just raised it to 12 because we have the increases. Every year, whatever the consumer price index says inflation is, the minimum wage increases by that much. And we're going to continue having that provision once it raises to $15 an hour.
Good.
Yeah, and that was, of course, thanks to the last ballot initiative.
Yeah,
because,
right.
Feel free to throw your questions in the chat if you're at home, or raise your hand. Dave Mallory's raising his hand, and he's going to yell really, really loud toward the speaker.
My question is, I don't know much about minimum wage, hourly stuff. Are fast food workers still included in this, or are they exempted?
No, every single worker in the state, except sadly for like federal workers, I guess, which includes a lot of university workers, sadly, because they're funded by federal grants. But there's nothing we could do to change that in state law. Federal minimum wage is still $7 an hour, or $7.25. I'm not sure. It sucks.
So anybody, pretty much anybody that gets a W-2 from their employer, unless it's a federal one, is covered by this.
If you're a state employee, you'll be covered by it. And if you're a private sector employee, including fast food workers, you know, delivery drivers, you'll be covered by this as well. Sadly, not tipped workers either. But
yeah, they always get exempted.
Well, that's what I was thinking. Fast food to me is anyone who When I said restaurant, that's not fast food.
You know,
that's
you
simple.
didn't mean McDonald's, you meant servers.
Right.
Yeah.
This is what I had in mind.
No, they're
Yeah.
always exempted, unfortunately.
Servers,
Like tip
do-
people.
yes, if they don't make $15 an hour through their tips, they would be held to this.
Okay.
Required to
But like their employer would not have to pay them $15 an hour before tips.
Yeah, okay. So at least they're guaranteed a minimum. They're not gonna work an hour and make $3.
Yeah,
So
there
It's a guaranteed minimum for them. That's good. Is that
there is a guaranteed minimum that their employers pay half of whatever the minimum wage is, so it would be like $7.50 under this new law, and then plus that whatever they make in tips as their wages, which normally goes over $15 an hour, but even still.
Thank you.
So are you suggesting that the climate that we're knowing the abortion one was trying to get on the ballot, that may have discouraged the politicians or the elected officials from opposing it right from the beginning, even last summer? That you feel that whole climate helped you?
It did, sadly. You know, I wouldn't necessarily say that it helped us, but it certainly meant that we weren't hindered unfairly, which sadly in Missouri seems to be something to aspire to, that you're not being obstructed.
Yeah. I think employers are seeing the writing on the wall too. My freshly 16-year-old a year ago walked into Hy-Vee. He's never even babysat or so much as mowed a yard. He's been pushing carts around their parking lot, and he makes like $15.70 an hour with beautiful benefits for his part-time job. And I think that's what they are finding they have to do to get anyone to work.
It's true.
So, I mean, I think we're getting less pushback from employers because they're like, well, I'm already having to pay $15 an hour, or I can't find anybody to work for me.
Especially
the new
here.
normal.
I'm from the southern part of Missouri. It's pretty much $12 is the standard.
Yeah.
But you know, even still, I think people realize that like eventually that's going to be the standard, either just through market forces or, you know, because the federal government is working on it, which means we got a lot less organized pushback. Still encounter people who are like set with this idea that low-wage workers don't deserve basic standards of living. Very sad, but luckily that's not the majority opinion.
Thank you very much for and your other young folks getting involved. We love to see that.
It's a salient issue for us. You know, we're the ones working most of those jobs. So
yeah, that's true.
But it's also a good to the community.
it's true. It's a very accessible, like obviously good thing. And luckily through organizing with this petition, I've been able to get in to involved with a lot of other organizations, including now the abortion access effort, which is what we're gathering for now on campus.
That's great. Thank you so much for your work.
Yeah, you know, hope to see y'all come out and vote yes in November.
Final question for Alec. You said you have enough signatures already. Have they been approved by the Secretary of State already?
No, it has not been approved, but we have more than enough submitted. And there's a vetting process that the organization does. The Jobs with Justice looks, and you know, I'm sure we're all familiar with the signature that's obviously not going to count. It's just like illegible scribbles, like boxes are missing. We don't count that in the totals. We have enough like good signatures in all the right places that hopefully it's going to get on the ballot. But again, who knows? Apparently the obstructionists have a bit more free time now, so.
Yeah, and that answers the last question in the chat, which was, did you have enough signatures? All right. Are we ready to move on to our regular meeting?
Yes, we are. So thank you.
Thank you so much. You can go around if you want, but you don't have to.
Did you sign there?
I did sign it, just a second.
Okay. Oh, you got it. Let's see how the sound works here.